Drug absorption. Drug absorption. This is nothing but the journey of a drug, which is traveling from the site of administration to the site of action. Actually, we can say it as the drug, which travels by some route of administration in the chosen dosage from, like in the form of tablet, capsule, or in the solution. So, absorption by the some other routes, such as the intravenous therapy, intramuscular injection, and the nutrition level, this may be available. So, we can say what is meant by the drug absorption. Drug absorption, this is a pharmacokinetic parameter that refers to the way of drug is absorbed from the pharmaceutical formulation into the bloodstream. Several factors can affect the absorption of a drug into the body. This include physiochemical properties like the factors that affect is the solubility and the drug formulation. Either it can be taken it as a tablet, capsule, or the solution. We can also say the route of administration, like how we taken that. It can be either the oral, we can take it as a orally, buccal, sublingual, rectal, pararental, topical, or we can also use as a inhaled one. And the factor that affects the drug absorption, last one is the rate of gastric emptying. The main pharmacokinetic parameter for absorption include absorption rate constant. Absorption rate, which we can say it as the amount of drug remaining to be absorbed. Bioavailability, amount of drug absorbed per drug dose. A drug must be solubilized in order to cross the semi-permeable cell membrane to reach the systemic circulation. This biological barrier exists to selectively allow or inhibit the passage of the native and the foreign particles through them. Absorption type. This is a passive diffusion. Passive diffusion involves the crossing of the pharmaceutical substance across the cell membrane from an area of higher concentration, such as in the gastrointestinal tract, to the area of low drug concentration, such in the blood. This is a passive process that does not require the energy, and the rate of diffusion is directly proportional to the concentration gradient. The other factors that influence the passive diffusion include physiochemical properties of drugs such as lipid solubility, molecular size, degree of ionization, the absorptive surface area available to the drug. These are the factors that affects in the passive diffusion. In general, lipid soluble drug and the drugs composed of the smaller molecules that crosses the cell membrane more easily and more likely to be absorbed by the passive diffusion. Here we get to know that lipid soluble substances are absorbed by the passive diffusion. As most drugs or the weak acid or bases, they exist in the form of equilibrium between the ionized and the unionized form in an aqueous environment such as gastrointestinal tract. The ionized form usually diffuses across the cell membrane more readily as it is more lipophilic. The ionized form, on the other hand, exhibits the high electrical resistance and it is less likely to diffuse across a membrane. The ratio of unionized form depends on the environmental pH and the acid dissociation constant. Absorption type. Active transport. The active transport requires the energy to facilitate the transport of drug molecules against the concentration gradient, which usually occurs at the specific site in the small intestine. The majority of drugs that are absorbed via the active transport share the similar structure with the endogenous substance such as ions, vitamins, sugar, and amino acid. Absorption type. Pinocytosis. This involves absorption of a fluid of the particles following their encapsulation by the cell. The membrane of the cell closes in around the pharmacological substance and fuses to form the complete vesicle, which later detaches and moves into the inside of the cell. This process also requires the energy to occur. Standard and the controlled release oral administration. When the drug is taken orally, it must be able to survive the low pH and presence of potentially degrading enzymes in the gastrointestinal tract before it can be absorbed into the bloodstream. Some peptide drugs such as the insulin cannot be given orally for this reason. There are some drug formulations that manipulate the properties of the drug to control the process of absorption. These are referred to as controlled release medication. These changes limit the drug of fluctuation of the drug concentration so that the rate of administration is slowed down and extended over the long period of time. Other types of administration. The drugs administered via intravenous injection or the infusion that do not need to be absorbed, so as they are delivered directly into the bloodstream. However, there are several other types of non-oral administration routes that must be absorbed through the cell membrane to reach the systemic circulation. These include buccal, sublingual, intramuscular, subcutaneous, rectal, topical, transdermal, and inhaled. So, the better understanding for this type of absorption. This is the journey of a drug traveling from the site of administration to the site of action. Drug absorption. This is a branch of a pharmacology that deals with the type of drug absorption technique. Here we can speak about the factors that affecting the absorption in the topical. They depends on the lipid solubility, which is a very increased. In the case of systemic toxicity, they may also cause abraded skin. They affect the cornea, which is permeable to the lipid soluble drugs. They also affect the mucous membrane of the mouth, rectum, and the vagina. So most of the factors that affect the absorption if it is in the higher dosages. Thank you.